an MRI of the lumbar spine of a fairly young person. This is a sagittal view, a T2 sagittal view of the lumbar spine. This over here is the front. This is the back of the spine. You can see the L5 vertebrae, L4, L3, L2, and then L1. Between them are these discs. This is L4-5, and this is L5-S1. This whitish space represents the spinal canal, and here you can see the nerve roots as they go down the canal. Now, the main thing I can notice here is you can see there's a difference in the discs. This here is the L4-5 disc. You can notice how this one is a little bit flatter, a little bit darker when compared to these other discs. The other thing to note is if you can see there's like a slight bulge right about here as it actually starts to encroach upon the spinal canal. So remember, the spinal canal is where the nerve roots live, and when they get pinched, they can cause symptoms into the legs. The other thing to note here is there's some whitishness right here, which might represent some increased pressure or edema of the vertebral bodies also within that same region. Now, whether or not this is a sign of pathology is really dependent on if the patient is experiencing symptoms. I'm going to switch to a different view in just 1 second. This view here is the axial view of the lumbar spine. Axial meaning that if you can imagine the person is laying down on their back, so they're actually facing towards the top of the screen. This is the right side, this is the left side of the body, so it's almost like you're looking from the feet up to the head. This particular level, I'm just going to zoom this in a little bit. This here is actually the T12 and L1 vertebrae level. You can see the spinal canal right about here. So all I really want you to do is focus on this area in particular. These little dots here represent the spinal nerve roots, and you can kind of see as I'm traveling down, you can also notice the shape of the spinal canal. It's normally an oval shape to circular, but with time, it can start to get more narrow and almost triangulate. So I'm going to keep scrolling down again. Make sure to pay attention to this area right in here. You're going to start to see that dark disc level, the L4-5 level, and right about here. It doesn't really look as impressive, but if you really pay attention, this dark rim right here, this is the beginning edge of that disc bulge. And the nerve roots are actually these little dots right here. So I'm going to scoot down just one more segment. You can see right about there, this disc here is starting to touch the nerves, and it kind of crowds it. And this is actually the descending L5 nerve root on the left side. This is on the right. So as I went down just one more cut, now you can really see that the disc is starting to touch the nerve roots, and nerve roots do not like to get touched. I go past that level and it starts to look a little bit more normal. So again, it's a kind of a very subtle finding. It's not always as obvious when you look at the other view, but this is kind of a good example of a relatively subtle finding on an MRI that can sometimes correlate with symptoms.